everybody. Good to see you all. Happy Monday. It's a Monday. Let's go. Think about this. It's Monday night. You guys are here right now to invest in yourselves and your health. That's awesome. Give yourselves a round of applause. Let's go. Come on. Awesome. One other shout out is the ACE Chiropractic team. Everybody raise your hand back there. Couldn't be done without them. Give them a round of applause. We got Eddie, Grace, Kate, Jenny, Shelby, everybody, let's go. It takes a team. Many hands make a light work. So we're very happy you're here. Got a lot of cool stuff. Raise your hand if you're at the last health talk we did a month ago. Okay, good. Awesome. We're doing approximately one a month is the goal, so one per month. And the people have spoken. They wanted to hear about the vagus nerve, so we will do what the majority of people want to hear about. Okay, a couple of questions. Let's make this interactive a little bit. Just shout out. What doctor, it's not a trick question, or could be, what doctor checks your eyes?
Ophthalmologist.
Nice, good job. Exactly right. What about the heart?
Cardiologist.
Ooh. Okay, 2 for 2. You guys are studied up. What about your teeth?
Dentist.
Yeah, plumber, right? Okay, what about your nervous system?
Neurologist.
Okay.
Chiropractor.
Whoa, okay. Good. Both correct and good answers, but the one we're looking for is the chiropractic, correct? DC stands for Doctor of Chiropractic. We like to say the Doctor of Cause. So we'll talk a little bit more about that. Now the nervous system, we heard nervous system, what does that mean? This is not a human body, it's a human nervous system. So your body is full of nerves. We're going to go in depth. We're going to start a little bit general first. So how many nerves do you think there are? Let's hear some guesses.
173.
Okay, that's a lot. Any other guesses?
Hundreds of thousands.
Whoa, okay.
Oh, right.
It must take a while to count. I don't know how you counted that many of them. But. Any other guesses? Let's see here. Well, an estimated 100,000 miles of nerves. That's not how many nerves there are. That's just how long they travel. Because there's a bunch of them that connect. 100,000 miles. To put that in perspective, it's enough to circle the Earth 4 times. Just in your body. In this picture right here. That's how intricate and detailed it gets. Talk about a computer. Now, most of that comes from microscopic tiny nerves that are all connected. So they all connect, create a ton of miles there. Now, more specifically, there's billions, some say even trillions, of actual individual nerve cell fibers. So too many to count. I don't know how they figured this out. They just did some math. But that is how many nerves there are. So we're starting general for a reason. We talked about who checks your eyes, who checks your heart, but who checks your nerves? How do you even check your whole nervous system? We'll talk about that. But now let's get into the specifics. We had a request, so we're going to talk about one of those trillions of nerves. Okay, so just so you know, it gets way broader than just this, but we're going to hone in on just this one today primarily. Okay, and we're going to tie into how what we do here correlates with just this one nerve. The vagus nerve.
All right, so we're gonna go over some anatomy here real quick because a lot of people, it's kind of a really popular fad right now is like the vagus nerve. I hear about it a lot, and it's something that's kind of just been a little bit newer lately. People are like, "What's the vagus nerve? Or what does it do again?" Or like, "I think I have vagus nerve issues," and things like that, right? So let's go over some anatomy so we kind of have a general understanding of what you're even looking at. What even is this vagus nerve that we hear about all the time? Well, it's got 2 main branches here. So as you can see, they come off the brainstem, right? Ironic. And then it travels down in the neck there on both sides. There's 2 of them, 2 branches. And then it goes to various organs, and it actually spins a little bit counterclockwise as you make your way down into the abdomen. So this is kind of what it looks like here. It's highlighted as well, and it has some of the innervations highlighted, as you can see, and some of its branches from there. But as you can see, it comes from here, and then it branches into 2 sides. And then it goes right down through the neck and then all the way down. It does not actually travel in the spinal cord. It's one of the very few nerve signals that do not travel through the spinal cord.
Now, as you can see, it branches out a bunch of different ways on all these organs, but they all come from the vagus nerve, okay? So there's a lot of different nerves that are going to play a role in what we're talking about for the rest of today. However, just know that its main source is going to come from the vagus nerve, and we're going to talk about where that main source is and where that comes from as well. So, there was your hint, if anybody saw that. If you didn't see it, what do you think vagus nerve, what does it stand for? What's Vegas? Las Vegas? Okay. What else?
I like where your mind's going, that's good.
Any other guesses? What do we think vagus nerve means? All right, well, it is Latin for the wanderer. They say the great wanderer because it's the longest, what they call cranial nerve in your body. So all you have to know is you have nerves in your head that allow your head to do what it does, 12 of them. And out of those 12, the vagus nerve is the longest. It's 20 inches, 20 to 24 inches. The rest of them, like the nerves that control your eyeballs, they're like an inch, 2 inches long. So this one is very long, but it has a lot of different functions we're going to talk about.
It's extremely long for the cranial nerves, especially since it actually does not, or it actually exits the cranium and it goes down into the rest of the body, kind of like we were talking about there as well. Now also to back up, along with that, originating on the brainstem there, what did we learn, for those of you that were at our last health talk, what did we learn about the brainstem? What specifically does the brainstem control? Obviously it controls everything, but what does it kind of in general control? What do you
Your
say?
central nervous system,
Okay, yep, okay. What did you say, James?
the spine,
Okay, the spine, sure. What else? What do you guys think?
everything.
Organs, exactly, yep. So essentially functions that we don't think about, right? So autonomic function is what we call it, right? The autonomic nervous system is what controls everything. And this is why it's originating on the brainstem. It's getting that autonomic stimulus because the vagus nerve, I think the vagus nerve, do I have to think about it to stimulate my vagus nerve to help my lungs expand and to make my diaphragm go down and to make sure that my spleen is working properly? No, that happens on its own, right? That's why it's originating on the brainstem. That's what's really important.
Good thing it's not like that because I would forget.
Yeah.
All right. So I'll touch on the last point there. It's 8 times longer than all the rest of those nerves that control the rest of your body and your functions and how you perceive life. Because you can feel things, touch things, hear things, see things. All those functions come from nerves. And like we said earlier, this one is 8 times longer than the rest of those nerves that control all those responsibilities.
Now, the vagus nerve is actually 80 to 90% afferent, okay? So when it comes to the nervous system, there's 2 types of signals. There's afferent and efferent. The only difference is the first letter, A versus E. Now, afferent is everything that's sensory, meaning its ability to sense what's going on, okay? So I like to think of it kind of like this. Let's say you have a car, and it's a really, really nice car because it has all these sensors all the way around it, right? It helps you park. It can actually park itself because it's really, I don't know, nice and new or whatever, right? Now, that car has really good sensory information all around it. But does that mean that it has the best performance? Not necessarily, right? They're 2 different things. There's efferent and afferent. Efferent would be like the actual signal coming out of the car. So essentially it's output. So I would think of it as like the driving capability, right? So if we had like an older, I don't know, what's like a good old muscle car? Like give me something, Carl.
Maverick.
A GTO.
There you go, GTO or Chevette or something like that, or Mustang, right? So it's really good performance, right? But what's like what's the sensory information on an old car like that?
Does it have a backup camera letting you know you're getting close to the
Yeah,
wall?
if I get too close to something, or does it automatically brake if the car pulls up from me? No, it doesn't, right? So you can kind of think of it that way.
Yeah.
So it's 80 to 90% afferent, meaning the sensory information is really, really good. So the vagus nerve is actually constantly monitoring the function of my body. So if I have an immune response that needs to be stimulated, it does play a role in stimulating immune response, but what it really does is it monitors everything and it lets my brainstem know, hey, this is not working properly, or I need to produce more of this or less of this. Does that kind of make sense? So a lot of people actually think of the vagus nerve as the opposite. They think of it like my vagus nerve isn't working properly and that's why I'm not producing enough of this or enough of this. Well, it's usually actually the opposite. Usually not enough information is getting to the brainstem and letting it even know that something's wrong, and that's why it's not producing a certain amount of X, Y, or Z. Does that kind of make sense?
Who's heard of I need to stimulate my vagus nerve, or I stimulated it, right? Stimulate it to do what? If majority of what it does is sense things, it's not actually putting input out, it's not doing the function, it's sensing the function. What are you stimulating it to do? The rest of that 10% it's very important to do. However, its main function is to sense things.
Absolutely. Now, it also does what's called parasympathetic function, rather. In the body, there's divisions of the nervous system. There's sympathetic and parasympathetic, okay? Sympathetic is what do you guys think? Fight or flight or rest and digest? Which one do you think? Fight or flight, exactly. Sympathetic is like, I'm running from a bear, right? So if I see a bear, I'd be very nervous if I saw a bear right outside this window, but if I did, what would I do, right? All of a sudden my heart rate's gonna go up, my blood pressure's gonna go up, I'm going to start sweating. My body's going to start sending a lot more blood into my muscle tissue. That way I can run from it or fight it or whatever needs to happen. I definitely wouldn't fight a bear. But that's what I'm going to start doing. That's a sympathetic response. Okay. Now, the vagus nerve is what controls the majority of parasympathetic response, meaning my ability to rest and digest. So after I eat a meal, my body's going to start. What happens after you eat a meal a lot of times? You get kind of sleepy, right? You start digesting, your stomach's moving around a lot. That's what happens when there's a parasympathetic stimulus. So this is what the vagus nerve is controlling. So that's why if you have malfunction with the vagus nerve, then sometimes you notice, oh yeah, like I feel like I have anxiety all the time, or like I can't go to sleep properly, my digestion's really thrown off, or I'm really inflamed, things like that. Okay.
Now, do you think, let's just pick sleep for example. If we have sympathetic, which means excited, right? You see a bear, think sympathetic. Or you just ate a meal and you're trying to relax and digest it, that's parasympathetic. What do you think sleep you should have mainly going? Sympathetic or parasympathetic? Parasympathetic, good, perfect. That is going to play a huge role later.
Okay, so we talked about this a little bit briefly earlier. Where does the vagus nerve originate? Say with me, it's my favorite structure of the whole body. Brainstem. Exactly, right. The brainstem. So both branches of the vagus nerve actually originate on the lateral aspect of the brainstem, aka the side. So you can kind of zoom in right here. We'll see it coming right off there, the superior aspect of the medulla, the brainstem.
Earlier we said there was 12 other nerves that control all these other functions in your body. These are all those other nerves there, see? All of them, and they're all like this long, this one, all the way down the body, all the way out. So just kind of keep an eye on what the vagus is.
Yep, and it gets a little bit more in depth as far as nucleus of origin versus apparent origin, meaning there's actually signals that can sometimes come from here that actually travel up and then exit the nerve, and/or where the signal actually comes from itself. The vagus nerve does get some information from the RVLM, which is the lower part of the brainstem here, but you don't need to worry about that unless you plan on taking a PNS exam next week, so you don't have to. Okay, so some anatomy there. Essentially, we kind of touched on. We can skip. Yep. Okay, so here's to kind of go back to our parasympathetic, sympathetic here, and this is really going to help you kind of digest that information and kind of make the delineation there. So here's our parasympathetic. Is this our running from a bear or trying to sleep after watching football and eating food?
Sleep.
That's right, rest and digest, right? So this is our pupil constriction, our slowing our heart rate here. It's actually going to vasoconstrict, because if I need to go to sleep, you think I need my airways open, or does it not need it that much open? I guess just closed, right? It means it doesn't need it to be open. I'm not about to run, so it's more constricted. My liver is going to release bile because it's trying to break down fats, right? My blood vessels are going to be more constricted because I don't need it to be expanded because I'm not about to go work out. Digestive system is working properly. It's stimulating peristalsis and motility. And then obviously if you're a female, relaxation of the uterus and urinary system is going to increase that urinary output. So this is all that parasympathetic stimulus. Now, to go back, is the vagus nerve necessarily monitoring, is it monitoring this or is it stimulating this?
Monitor.
It's mainly monitoring, right? It does stimulate it, but it's mainly monitoring. So that means at all times of the day, your vagus nerve is actually getting information from your digestive system, and it's saying, okay, like, am I hungry, or do I need to eat, or am I breaking this down properly? Is it inflamed or bloated? And it's monitoring all these things and way more on top of that. This is just kind of a good example to show you guys. Now, it has a ton of immune function as well, so the immune organs like the thymus, or the spleen, the bone marrow, the lymph, all of that is being monitored as well via the vagus nerve. Going over to the sympathetic nervous system here, this is not the vagus nerve that's actually being stimulated when you're running from a bear, or that sympathetic response here. That'd be your pupils dilating so I can see the bear better, or increasing my heart rate, right? Or dilating the airways, or sweating like we kind of talked about earlier. Oh yeah, increasing rate of glycogen to glucose, so essentially turning it into energy, or activating that ATP there. All of this is that sympathetic response. Now, what's interesting is you would think, okay, so then if I'm having these issues, how is it a vagus nerve issue? Wouldn't it be a sympathetic spinal cord issue? Well, not necessarily, because the vagus nerve actually has a very healthy relationship with balancing this out. So, how many of you guys have ever heard like someone, they get really scared and they pass out. You guys heard of this before? Okay, this is a real thing. I don't know if has that happened to anyone in here before? Just curious. Or has anyone seen that or known of someone?
I would think that a man's going in to get a shot from the doctor's office and then they get
Okay, well that actually reminds me of something funny. A couple weeks ago I was getting like some life insurance or something and I had to get my blood drawn. I don't like needles. That's why I'm a doctor that hasn't used any needles or anything like that. And well, you guys can kind of say what happened, Grace. What happened to me?
He turned white and practically passed out.
Basically passed out, right? Okay, so, oh, by the way, this is in the office. So you guys know.
It was a fainting goat. You ever see those fainting goats? It's like a defense mechanism.
Yeah. So, what actually happens there? Why does that even happen in the first place? Well, what happens is you actually get so sympathetically activated, like I need to run from a bear, and it increases my heart rate, and it vasodilates my skeletal muscle, and all the blood's exiting my brain, and my sympathetic's going way up. So what happens is that healthy relationship of sympathetic and parasympathetic tries balancing each other out. My parasympathetics went way up, vasoconstricted a ton, and tried to actually overcompensating, and then what it does is it reduces too much blood flow and I end up passing out. So it's actually really, really unique to see how the body's constantly trying to adapt. In fact, I got so scared, my sympathetics went so high, my parasympathetics went up, sympathetics went down, and I was stuck up here. That's why you can pass out. Pretty cool, right?
Now, when do you...
Or we're gonna say Don.
I've seen it happen to guys at the altar when they're just about to get married.
Definitely am excited for sure.
It's like leading up to the wedding, parasympathetic, and then day of the wedding, sympathetic, right? Fight or flight, running from a bear.
It even affected my car. It wanted to go the opposite of the way of the church.
Yeah, exactly.
Now, when do you think most healing occurs? Everybody says you heal when you're what? Resting.
Yeah.
When you go to sleep. Sleep at night, you grow, you heal. Well, which one's activated when you're sleeping? Parasympathetic. It's able to digest food. It's able to get
Absorb
blood.
nutrients.
Yes, absorb nutrients. So
Reduce inflammation.
Yep, all those things come with this. So that's another way that you can heal better is when you're using more of your parasympathetic. All right, so inflammation. Who has heard inflammation's bad? Inflammation,
Yeah.
chronic inflammation,
Yes.
very bad, chronically, right? Inflammation's a good thing. If you hit your shin on something, like a scooter, worst pain almost ever, not
Step on Legos.
your shin gets a bump on it. That bump is putting a ton of blood there, a ton of inflammation to heal that area. If you get rid of that inflammation, you're getting rid of the healing process. However, the vagus nerve plays a huge important role with inflammation in a healthy way.
Okay, just curious, has anybody heard of TNF or tumor necrosis factor? Anybody heard of this before? I'm just curious. Okay. Unless you do what we do, you probably haven't. So we're going to kind of talk about it a little bit here. This is one of the inflammatory markers or cytokines that your body produces. One of the many, by the way, just a well-known one in the health world that actually causes inflammation. Okay. Now, what did we say? Inflammation in general, is it good or let's say this. Acute inflammation, is that good or bad?
Good.
That's good, right? Exactly. So if I kick my shin on something and it starts inflaming it to heal it, that's a good thing. What about chronic inflammation? Bad, right? Exactly. So keep in mind, your body's always adapting as best that it can. So this is actually a good thing for a short period of time. But if it's there for a super long time, it can cause chronic inflammation, right? Now, the vagus nerve is what moderates and monitors the inflammation process, okay? Now, like we said, what does the vagus nerve do? Is it mainly monitoring things or mainly stimulating things? Mainly monitoring, right? So if it's monitoring this process here, and there's reduced nerve signal, the vagus nerve actually inhibits TNF and interleukin-1. There's many interleukins, but we'll kind of talk about IL-1 for now. Now, before I lose you guys, because I can already see everybody's like, what's going on here, okay? Before I lose you guys, keep in mind, these things inflame, okay? So good for the short period of time, not good for a long period of time. So the vagus nerve actually inhibits these things. Now, it doesn't mean that it inhibits it at all times, it just inhibits it when it's not supposed to be there any longer. Meaning if the vagus nerve determines, okay, this is healed pretty well, we can stop inflaming this area, then it's gonna stimulate the brainstem once again, hey, let's stop doing that, and then it sends that signal to inhibit it, okay? Now, like we talked about, it senses inflammation, so the vagus nerve actually has afferent fibers that go up, and it detects these cytokines like TNF, IL-1 in the body, and then the efferent fibers go back down, and they essentially will reduce it, okay? Now this message tells the body to release acetylcholine, which we'll talk about in a second, and then it basically binds to it and it prevents it from being chronically inflamed. So this is why you'll hear people say, oh, I have chronic inflammation, I got vagus nerve issue, right? And it can be true, absolutely, for sure. Like maybe your vagus nerve is being interfered with and that's not sensing the inflammation properly, and that's not even getting to my brain, so it can't even get to the point where it's able to stimulate the signal to inhibit this, right? So this is kind of the inflammation pathway that you would be going down if you have chronic inflammation. And keep in mind too, this can be something that people live with for years, decades actually, because if their body's not functioning properly, there's nothing wrong with the body, it's just the signals being interrupted. Whether it's actually on the brainstem itself, or whether it's right outside the brainstem where the atlas is right behind it there, which we'll show in a second. You can go from
So the two things to remember is TNF and IL-1. The next one's about IL-1. So how does it interact with it? So same thing, it's sensing information. So it's made by your immune cells. So the vagus nerve is saying, hey, we need to make more of anti-inflammatory substances to reduce the inflammation when it's been too long inflamed, when it's been inflamed for way too long. So TNF and IL-1 is trying to reduce those things once it's too far gone, essentially. So same kind of recap here.
Just to kind of make it look like not too wordy, just throw it up there for the next one. Okay.
So some more information about what it controls. We're going to highlight one here, which is heart rhythm and rate. How in the world does this vagus nerve thing control your heart rate and your heart rhythm? If we're talking about inflammation, we're talking about sensing things, how does it control how much blood your heart is pumping all the time? Well, I'm glad you asked. Yeah. Yep.
That's right.
It's basically one important thing when it comes to the body is cycles. So we're going to show you a cycle right here. Oh, and breathing. So here is a cycle here. Now, here's the vagus nerve. It's part of this cycle here. And it's constantly monitoring it, saying, hey, we need more blood to these areas. If you see a bear, so it's going to increase it. Or if you're trying to rest and relax, it will slow it down. Okay. Acetylcholine coming into play here.
Sweet. All right, so now we're going to talk about some things here real quick, because I want to give you guys something. Obviously, the most effective way to make sure your vagus nerve is functioning properly is going to make sure that there's no pressure on your brainstem. That's going to be the most effective thing, bar none. But I want to give you guys, the people that have already been receiving that kind of care, right? We want to give you guys some also some things that you can take home with yourself as well, make sure that you're optimizing and supporting properly as well. So, let's get into it here. Okay, so choline-rich foods. What does that mean? Okay, so choline is one of the precursors. Is it on there? Yeah, it's converted into acetylcholine in the body. So I'll kind of explain what that looks like here real quick. So if we have, let's use the back row, pick on you guys. Okay, the back row in the room here, there's a bunch of people, okay? Now if we think of them as nerve cell bodies, meaning there's a nerve cell body there, and then it transmits to the next one, and the next one, and the next one, and that makes up an actual nerve. So there's little cell bodies in between each one, okay? Let's say they had to high five each other in order to complete the signal and keep going. The high five itself is what's called acetylcholine. That's like the neurotransmitter that actually sends a signal. So what can happen is if there's not enough or improper acetylcholine, the neurotransmitter in between, then the signal's not going to be sent as effectively, or can be miscommunicated with, or it can be slowed down. The conduction velocity can be slowed down, and it can interfere with it. So we want to make sure that our body's being supported properly, okay, with vitamins and nutrients that are going to support choline.
So, long story short, to get the acetylcholine, you need choline. Your body will take it and produce that, so that way that nerve signal can function better. Because what do the nerves do? They control some things, or how much of it does it control in your body? The nerves. All of it. So you definitely want to make sure the neurotransmitters that are important for the nerves to actually function properly, you're getting that information as well.
So I cut to the chase. I saved you guys the wonderful opportunity of me going into the in-depth biochemical neural pathways there. But what we'll do is we'll just give you some food instead. So if you guys want to take your phone out, take some pictures of this, you can definitely do that for sure. These are going to be some foods that are going to be high in, for one, certain B vitamins that are going to help with nerve conduction velocity, choline precursors, and many other macronutrients and micronutrients that are going to help support the vagus nerve. One, for example, that always comes to mind is vitamin B12. Okay, so for example, if my body, if I was not getting any vitamin B12, and usually this happens if you have a vegan diet, then you actually can lose nerve conduction velocity and signal, and you actually can develop neuropathy. And there's a lot of cases of people that are vegan that actually end up going blind because of this. So if you are vegan, you probably have heard of this. Make sure that you get vitamin B12, right? Obviously, I would suggest just getting vitamin B12 in your diet. But that's something that's really important. So I kind of chose to not just include all the different vitamins and macronutrients, and now you can just kind of have some foods that are really going to help support it, okay?
Now, getting acetylcholine or choline from your diet isn't going to help just your vagus nerve. All of your nerves, and all of your nerves control everything. So it's very, it's not a treatment specifically for if you think you have a vagus nerve issue. This is just important. It's just like drinking water, right? Water's good for you. If we're in the desert and you don't have water, it's bad for everything. So same with this here, this concept.
Okay, so now here are some acetylcholine or choline rather inhibitors. So things that are going to actually inhibit that neurotransmitter. Now, does this mean if I eat potatoes, my vagus nerve isn't going to work right? No, it doesn't mean that. Okay, just so you guys know, my body is very intelligent and it knows how to operate properly. But if you are like, you know what, I'm just trying to maximize things and I want to make sure my vagus nerve is working properly 100%. I never even want to run the risk of inhibiting any of this ACH. Here you go. I don't even like mushrooms anyway, so there you go. I mean, does anybody actually like mushrooms?
Yeah, I do.
Wow,
He's
sorry,
done,
guys.
get him out of here.
Sorry.
We'll have to put some for some of the snacks next time.
Yeah. I didn't say they weren't good for you.
All right. How does this relate to sleep? We've talked a lot about parasympathetic activity. So let's see. Who wants to give one bold claim how the vagus nerve and sleep are related? We talked about parasympathetic, sympathetic, sleep, rest, and digest. Anybody want to give just a guess? No wrong answers. One guess. How could it be related?
Because it sends signals, and it gets signals, and it knows, and when it's trying to slow down all the things that you need to rest, it's in that cycle.
Exactly, 100%. It knows exactly what to do. So this gets kind of in depth. The main point is that it controls so many things important with sleep. So let's go through a couple of them. So it activates, we talked about it, the parasympathetic nervous system, so that's what that's short for, which slows your heart rate. Do you think it's easier or harder to fall asleep if your heart rate's slowing down? Easier. So you definitely want to make sure your vagus nerve is working properly. Okay, it sends a signal to this thing here, which is on the brainstem, which we've been talking about. Remember, it goes all the way up and connects to the brainstem. Sends signals to the brainstem. Those signals go to these areas. Let's go through them. This right here, hypothalamus, it's the regulator of your actual circadian rhythm. Okay, so if you're doing a sleep study and they look just at your hypothalamus, they're missing a big part of the picture here. All the rest of the body, it's a cycle, just like Janice was saying. So you can't just get too zoomed in on one thing. You want to make sure all of these things are working properly. So your circadian rhythm, which is getting signals from the vagus nerve, that ties in there too. That's just another way. Your thalamus, which is another structure in your brain, which is getting signals from this vagus nerve, is important for sleep initiation. Who here, I still play this game, but when you were a kid, you tried to be like, I'm gonna know the exact moment I fall asleep tonight. And then you'd wait for it, and then you would fall asleep and wake up and you're like, dang it, I didn't know when it was. Like I used to always try to pay attention to when I would hit that tipping point and fall asleep. It was like a game I would play with myself. But that whole cycle, there's an inhibition to certain things that keep your body conscious, and then all of a sudden you're asleep. And that's important for healing, like we talked about. So again, vagus nerve, sending signals to the brainstem, which go and tell this area, hey, it's time to fall asleep. So that's important too for sleep. Now, your amygdala, anybody know what your amygdala does? That one gets kind of famous too, just like the vagus nerve. Anybody know what the amygdala is responsible for?
Lets out the noises or something?
It's a good guess. I'm looking for something specific. We were talking about seeing a bear. Who would be actually...
Fear bear.
Yeah, your fear center. It's huge for that.
Fear.
So your fear center, your limbic system, your mood, your regulation of your emotions, that can affect your sleep quality. Who's ever gone to sleep and they're super anxious and been like, oh, I fell asleep super good? Doesn't happen very often. So if your vagus nerve is responsible for all these things that are responsible for how good of a quality of sleep you get, because who's had a ton of sleep but they didn't feel well rested? Happens all the time. Or they just had a hard time falling asleep. They can sleep a lot and they get quality sleep, they just can't fall asleep. These things are all interconnected. One nerve, how many nerves were there? Trillions, right? And the vagus nerve itself has tons of nerves within it, but this is very impactful for sleep, and we'll show you a better picture here in a second. So again, all the organs, just another fun slide to look at how it is a cycle. It's all talking to each other, so we can't get too zoomed in on one thing. Okay.
Do we have the lower the pineal gland? Is that in here too?
I think so.
Okay. All right, I'll wait now.
All right. So some other ways to support the vagus nerve, because like we said, bar none, most important thing is make sure there's no pressure on it. Otherwise, it can't function properly, no matter how much food you get or supplements you get or sleep you get. If there's pressure on it, it can't function properly. It's like a garden hose. If you have a garden hose and it's putting water to the garden and you're stepping on the hose, it doesn't matter how much sunlight those plants get. It's not getting enough water. At the end of the day, those plants will suffer. So a really good activity, I want everybody to try this right now. This is something you can try before bed. Mainly before bed is going to be the best thing. It's best to have somebody do it to you, but we'll do it to ourselves. If you guys don't have sensitive ears, this is called figure eights, okay? This is going to help relax you, and it kind of, you could say, it stimulates your vagus nerve. Basically what you do is you kind of pinch back of your ears. Everyone can do it right now if you want. And you want to relax your head. So again, remember, you would want your head to just be completely relaxed, laying down, someone do this to you. Now, you're gonna make figure eights with your ears and let your head go with it, okay, in one direction. And then you relax and you go the other direction, okay? It's just a calming exercise you can do to try to help relax and get some sleep. So have someone do that to you and you'll probably fall asleep while they do it to you. So, but you can do it to the kiddos. If the kiddos are being crazy, you can do that to them, just kind of help them fall asleep a little bit.
All right, so cold exposure is another good way, of course. This is actually not for something that's like an instantaneous, like, I'm not saying like, I can't fall asleep and then go hop in the ice cold water, that's not what I'm saying. However, cold exposure is really, really important for stimulating parasympathetic activity, or specifically the vagus nerve. So if you take cold showers, who loves taking cold showers? That's me, right? No. Come on, you do not. I'm just kidding. So cold showers or cold plunging, of course, typically earlier in the day is actually going to kind of set you up for the day to actually have your circadian rhythm regulated a lot better, and that's obviously mediated through the vagus nerve. So that's another really good way as well. There's a lot of literature kind of back and forth on this, but essentially the overwhelming stance is that the cold exposure is good for vagal tone. We talked about this with circadian rhythm already being a result of the vagal tone, but your circadian rhythm from outside factors is really important as well. So there's parts of your circadian rhythm that you can actually control without it being just all autonomic. Meaning, if I am jogging, do you think I'm just going to all of a sudden fall asleep? No, I kind of have to prepare myself for bed, right? So I have to be like laying in bed, close my eyes, try to relax, things like that. So if I'm on my phone, and I'm looking at blue light, or I'm watching TV and it's got blue light and it's stimulating, or it's actually stimulating, inhibiting my pineal gland from making melatonin, then I'm way less likely to fall asleep. Now keep in mind, the vagus nerve is always monitoring these things, and it's kind of a negative feedback loop. So what I mean by that is it's preventing you from not falling asleep in the first place. So if I'm jogging, do you think my vagus nerve is going to stimulate my pineal gland and say, oh yeah, go to sleep right now? No, it's not going to, right? So you have to do kind of your end of the job as well in monitoring the circadian rhythm, because if you don't, then it's not going to all of a sudden just work properly, okay? So by that, trying to avoid any adrenal responses before bed. So reducing your blue light exposure or any screen exposure 1 to 2 hours before bed. I know that sounds like tough because a lot of people will be like, I watch a movie and then fall asleep, right? But that actually can throw off your circadian rhythm because now your vagus nerve is not actually in that cycle properly. It's all about cycles. Your body's in so many different cycles. So trying to avoid that as well. Trying not to stress yourself out before bed. So obviously, like couples, don't try to hash things out maybe right before bed. I'm not really the one to give any couple advice, but essentially, like, don't be doing that. Don't be stressing yourself out, right? And keeping an eye on all of your sleep cycles. So trying to fall asleep at the same time every single night, waking up at the same time every single night, it's that is going to highly promote your vagal tone and or the proper vagal tone. Not even just heighten it, it's just going to allow it to regulate more properly. Does that kind of make sense?
Mm-hmm.
Okay.
It's almost more important to set an alarm clock for when to go to bed instead of wake up. So you want to just make sure you are consistent, because your body will wake up when it got enough rest. But if you don't give it the ability to get that rest at the same start every time, you're going to run out of time and it's going to change, and that's the circadian rhythm can get all out of place. Now, subluxations. Anybody know what a subluxation is? Have you ever heard that before? Raise your hand. A subluxation. Vertebral subluxation. Yeah, that's misalignment of pressure on the brainstem, medulla oblongata, reticular inflammation.
Damage to
That's right here. Every time you hear us talking, every time you hear that whole ramble from us, or you hear subluxation, this is what you can think, okay? This is the top bone in your spine.
Wait, I'm just curious. Who in here has heard us say just Atlas misalignment, putting pressure on the brainstem, medulla oblongata, reticular formation, nerve tract center? Who's heard us say that? Okay. Sometimes it must be certain people stick with. So this is what we're talking about here. This is the atlas here, and we're looking at it as if like I kind of got sliced right here. We're looking straight down. So this is called a transverse view or a axial view, looking straight down. Okay, this is the atlas right here. This is your brainstem and or spinal cord, and right in front of it here are your internal, actually, well, it's called the carotid sheath, but it's where your internal jugular vein, internal carotid artery is. And right here, this little purple thing is the vagus nerve. So kind of give you a little bit of an idea, the proximity of it to the atlas there, okay? Now, what do you guys notice about this image here? If you had to kind of look at the atlas and look at the carotid sheath, okay, it's not straight. Exactly. Exactly, 100%. Exactly. And some people in here probably have atlases similar to this, right? No, so this is rotated, right? And when it's rotated, because of the really close proximity to the carotid sheath, the vagus nerve itself can actually be quote-unquote pinched, right? And do you think the signal that's coming from the brainstem down through this, you think that signal is going to be better or worse?
Worse.
Worse, right? It's not like the garden hose analogy that we just talked about. It's putting pressure on it, and it's decreasing vagal tone all the way down the entire body. Keep in mind, there are millions of, or not millions, but there are many branches, millions of neurons, but many branches from just that one side that go to your spleen, go to your liver, obviously, your kidneys, your appendix, everything, your entire body. Well, not specifically just the left side, but the point that I'm making is it controls a lot and monitors a lot. So it's very, very important that this is not happening. So this is why there's people that maybe they have chronic immune issues, or there's people that be like, man, this person's just always sick all the time. I have this going on. This is an immune function that's being disrupted. Or they're not having, like, man, they do not get the proper sleep. Or their digestion is all messed up. They have chronic inflammation. This is why people come in to specifically upper cervical chiropractors, and they have these issues, and it's resolved very easily. And it's because just as simple as something like this. Now, keep in mind, we're just talking about a one-directional misalignment here. Of course, it can tilt up, it can side slip. There's many other misalignments. But this is one that directly impacts the vagus nerve.
Now, for as much as the vagus nerve does that we've talked about this far, if you drink enough water and there's pressure on it, can it still have problems? Yeah, it's got pressure on it, right? What about if you get enough choline and you get the acetylcholine process working properly? Yeah, it can still have problems. What about enough supplements? Sleep, you got the sleep routine down pat, but you still are stressed out, and you don't have a lot of stress in your life, but you're always stressed all the time.
What if you artificially stimulate it?
Yep, you're doing your figure eights, and for some reason you still can't really fall asleep. This is, no matter what, going to cause the decrease in function in it, no matter what you're doing outside of it. Those things are great, and you should always do them. You should exercise, cold plunge, do all that stuff. However, if this doesn't get corrected, this is a huge cause to the rest of it, the great wander.
And keep in mind too, real quick, as well, this nerve, even if this isn't rotated enough to actually put pressure on it, this nerve, where did we say it originates, guys? The brainstem, right? And what does the atlas protect? Do you guys know? Okay, so it can actually interfere with the signal 2 different ways as well. So keep that in mind.
Okay, so circadian rhythm. Let's pretend we know what all these nerves and things are doing exactly scientifically to produce sleep. Let's say we know all that. Let's just say this is the cycle it has to do. It has to constantly communicate, because at the end of the day, things down here communicate to things up here to come back down here to help you fall asleep. That has to happen. This can't be interrupted, okay? This is that top bone in the spine. You're facing this way. Now, what can happen to this signal? It's like a cycle, like we're talking about, it's going back and forth constantly. It needs to communicate. Your body has to communicate. When this top bone misaligns, puts pressure on the brainstem, this signal gets interrupted, just like with pressure on it, right? So you can still live, you can still function, you can get sleep, but you're not at 100% optimum sleep and recovery and digestion. So, what do you think we should do? Should we increase our choline in our diet? Well, we already have a pretty good diet. We checked it all off. Should we try to go to bed earlier? That doesn't really help. I still feel tired. We should probably take care of that top bone in the spine anytime that happens so that this cycle can improve again. And that's just one cycle in the body. We're talking about the vagus nerve specifically out of those trillions of nerves. And they all go through this area.
Now keep in mind too, this is what's so important, and this is often the most overlooked aspect of vagal tone. So for example, if you Google, why is my vagal tone decreased? Do you think, oh, your atlas is probably misaligned in 3 different directions? Think that's coming up on Google? Not necessarily, right? So you're gonna find the other things a lot quicker before you're gonna find this out. Now, there's a lot of people, and this is why that you've probably experienced this in your day-to-day life as well. If you talk to people, and they're like, yeah, I just have a chronic gut inflammation. It's just, it's just really bad. And then, you say to them, well, make sure you're getting proper choline and make sure you're reducing your natural anti-inflammatory foods and items like that. And they're like, yeah, I've already been doing all that, right? You see what I'm saying? It's like, this is not people's first thing to run to is to get this examined, right? It's the other aspects that we discussed earlier. Now, it's super important to make sure that you're supporting your vagus nerve 100%, but this is why we bring this up.
What's this right here? Melatonin. Your body produces it naturally. It knows how much to make all the time. So there are times where people may feel like they have to, take melatonin. That may be the case because obviously they're not sleeping properly. So what else are you going to do? A lot of times the melatonin production is being inhibited by the cycle here. So once you start taking melatonin, your body thinks that the cycle is not interrupted. So you're kind of dependent on it in a little bit.
It's like overriding it.
Yes. Yeah. A lot of times when this gets corrected, that the need for that melatonin artificially is not really needed anymore because the body knows what to do. You just don't want any interference there.
In fact, something that you'll notice is that we didn't recommend in any of the things that we did recommend, we didn't recommend taking melatonin. And you know why? It's actually really important to not take melatonin. And the reason for that is because it's a hormone your body produces, and how hormones work is that if you have an amount of hormone in your body that's normal, then your body thinks, oh, I don't need to produce anymore, right? So if I'm artificially taking this hormone, my body thinks, I don't need to make it anymore. So what does that automatically do with my body? It makes it dependent on that, right? Exactly, it stops. So if I'm taking melatonin, and my body is, the vagus nerve, it's sensing how much melatonin I have, and then it's like, you know what, I don't even need to make anymore, so I'm good. And then what happens now, my body's not even making it anymore, my melatonin goes down, and I'm highly dependent on it. Plus, to be fair, I have no idea how much melatonin my body needs at any time throughout the day, so I don't want to artificially stimulate that. My body is a lot smarter than I am. It knows how to function pretty well.
We said there's how many cells in the body? Nerve cells? Just nerve cells? Billions? So it's a lot smarter than I am because it's controlling just billions of nerves, and those nerves are controlling tons of functions. So not only is there billions of nerves, those nerves are controlling tons of functions. I have no idea how many little things are going on in the body.
Okay, so the only reason why I included this is because people ask me this all day, every single day, is, wait, can I just artificially stimulate my vagus nerve? Like, isn't that like something that I can do? My vagus nerve isn't working properly. Well, I didn't have this in here, but essentially my first question would be, how do you know it's not working properly, right? Like, is there any objective way of being able to know that it's not working properly other than the symptoms? Because symptoms are not a huge indication on how my body's really functioning, right? So that's a different tangent. But essentially, when people use different devices that artificially stimulate the vagus nerve, oftentimes it's not going after the cause, right? So I would always suggest try to make sure that your nervous system is being supported by the way that it's supposed to be supported through diet or proper daily habits, or also just making sure that signal's not being interrupted with, right? So there's different types. Of course, I put in here, there's a time and place, of course, for these different devices to be used. Of course, if there's injury to the vagus nerve and you need something in there to stimulate it artificially, of course. but in most cases, you do not need to be dependent on this. Now, there's obviously different types of vagus nerve stimulants. There's some that are more invasive than others. I think we have, go to the next slide. I think I have it in here. No, I don't. Okay, but essentially there's some that are subcutaneous, meaning they implant it under the skin, they stimulate the vagus nerve. There's others that are outside of the body, they kind of use like Bluetooth signal. There's a plethora of different ways that they do this. But in most cases, I'm gonna say most cases, like 99% of cases, you probably don't need that. So I wouldn't run to jump and go get dependent on something like that to stimulate it when that might not even be, or that's not even what's causing the issue, unless you have a damage to that nerve itself.
All right, so some more location. Here we zoom in a little bit here. So this would be like the back of your head, back of your spine. You're facing this way. And here's that top one on the spine, which protects your brainstem. And right in front of it is that vagus nerve within that carotid sheath there. So super important.
Keep in mind too, when it actually, it's coming from here, right? So it's coming from the brainstem. So it goes from the brainstem all the way up, well actually a little higher, but right here. It comes from the brainstem and then it goes all the way around here and exits. So this can misalign, putting pressure on the origin of it, but it also can misalign, putting pressure on the nerve itself. And this little thing here is the carotid sheath that we were showing in that image earlier.
What is vagus nerve Latin for again?
Wander.
Yeah, wanderer. Super long. This is not like any other cranial nerve that you have. Okay. So here again is that subluxation we're talking about, where the Alex misaligns, putting pressure on the medulla oblongata, reticular formation, nerve tracts. Okay. So we come in here and we correct that, taking pressure off of it, allowing it to function the way it's supposed to. It knows how to function. Think about this: 2 cells came together. 2. We talk about trillions of nerves and billions of nerves. Let's just take 2 individual cells, they come together, and in 280 days you have billions and trillions of cells that develop without the help of any medical doctor or chiropractor, all on its own. And then boom, a functioning human baby knows what to do. So the body's very smart, we can acknowledge that, but if there's pressure interfering with these nerve signals, it's not going to function better no matter what you're doing outside of that. Okay, so how common is a vertebral subluxation? So they've done some studies here with infants, and this is just with infants. The older you get, you start getting in other kinds of accidents and injuries. What's a big accident of the head that you can think of?
Whiplash.
Whiplash, right? So most of the time, infants probably are not in as many whiplash injuries as adults. So this is the cause of this is very different. However, 1,250 infants were evaluated during the first 5 days of their life. Okay, so bones are still modeling and being shaped and formed, and 90% of them suffered birth trauma enough where it caused subluxation. So in the next slide, it kind of goes a little bit more in there. So 1,000 were checked for the first month of their life, and 80% of them were found to have a misalignment in the upper part of their spine there. So how important is the development of your ears as a baby? Super important. That's where most of it's happening. So you want to make sure that this is functioning at its absolute peak, because you can do all the proper things for development of a child and their nervous system, but that is the most important area to protect at that age, really any age of life. The best time to receive chiropractic care is now, or well, the best time is at birth, the next best time is now, because you can't go back in time.
And another thing too is you hear obviously with a lot of parents are like, oh, baby's not having the best sleep issues or they're having digestive issues, and that's often because of, once again, the parasympathetic activity. So when we have littles that come in our office, one of my first questions is how's sleep and how's digestion, because of those functions that it monitors and mediates.
Okay, so what do you think happens when there is no interference in this area? We talked about all the things that can happen when there is interference, like digestive issues, sleep issues. What about when there isn't interference there? What if you don't have any problems? You're like, I'm fine, I'm healthy, I'm great. This is what we call side benefits, okay? Not side effects, side benefits. These are outcomes of individuals who were asymptomatic, meaning they didn't have any problems. They're like, I'm great. This is their normal, okay? What happens when there's no interference to this area? Your new normal is a better, healthier, happier life. For example, autonomic function is improved, cardiovascular function, immune function, respiration, range of motion, reaction time, your stress levels improve. So these are people who had no issues, and these are the improvements they saw. They didn't say, I'm having breathing problems, I'm having immune problems or cardiovascular problems. They thought they were normal. So this is how impactful it is when there's no pressure to the brainstem. Who is this guy? Anybody know?
That's Brandon.
Yeah. This is BJ Palmer. He's the developer of chiropractic. What year was chiropractic discovered? Does anybody know?
1866.
Any other guesses? 18 something. 2015, actually. This kid.
That's when you were born.
So, chiropractic was discovered in 1895 by this guy's father. He took it and developed it to kind of an advanced method of what kind of we use today. We have a more advanced version of it. And this is a quote that's super impactful. We never know how far-reaching something we may think, say, or do today will affect the lives of millions tomorrow, right? The smallest thing you do today for your health could have been deciding to come here today. It can have a huge impact on somebody's life. You could go tell somebody who you know has migraines or vertigo, you're like, hey, I went to this health talk, I heard that this controls everything, might be able to help, and then their life gets changed just because you made a simple decision to come here today. So, I always love that quote. It's very good. And then, that's all we have for you. If you have any other questions or whatnot.
I do have a question that
Yes.
kind of goes way back in your talk.
Yeah.
You mentioned something about vagus nerve helps with your arrhythmia. And I have AFib and a pacemaker. Does adjustments in your neck area, does that help your arrhythmia, or is that beyond that?
Good question. So it totally depends on the cause, once again, right? Now keep in mind, what we do is not a treatment for cardiac arrhythmia at all. It's not a treatment for anything, actually. However, if you have pressure on your brainstem, it definitely can lead to arrhythmia, but not in every single case. So you're definitely way better off without pressure on your brainstem, but it doesn't mean that it's a treatment for it. And once again, too, it's not the adjustment that's doing any of the benefit, it's the lack of needing the adjustment. So sometimes that results in you having to get an adjustment, take pressure off the brainstem and let your body function properly. So it doesn't treat it, but sometimes if there's pressure on the brainstem, it can cause it, absolutely.
So it can help in some ways, possibly.
It could if that's what was
I'm not
causing
worried
it.
about myself. I have to-
Right. If that's what was causing it, it definitely can, yep.
Any other questions while you guys are, I see you reading this real intently, like, what's going on?
Yeah, what other questions you guys have?
You know what? It's funny. I never knew about the vagus nerve until my daughter. Okay? And I'd been into medical classes or whatever. But why do regular chiropractors don't bring this up? But you guys are more at a different level than a regular chiropractor.
That's a great question. Do you think that it's fun to study and research all this? No. So in grad school, obviously, we all learn the same thing. So a traditional chiropractor out there that's doing something completely different than what we're doing is just as knowledgeable about it, believe it or not. It may not seem that way, but it's true. Now, you can either choose to remember it and apply it and continue to use it and continue to educate your patients with it, or you can choose to kind of dump it and do other things. In fact, on top of that, like in our office, obviously we use neurologic scans, and other chiropractors don't do that. So it takes a lot more of a analytical mindset and attention to detail mindset and a more patient mindset to take the extra measures to do those things, and that just isn't fun. That's the best way I can explain it. Or there's the argument in grad school too. Some people will say patients don't care about that. I've heard that as well, believe it or not. So it's funny because then obviously I have these conversations with those people and I say, yes, they do care about that. In fact, these are the people that are not getting help from traditional
Yeah,
methods.
it's just a continuous, you're just going in years and years and nothing's happening. Yeah.
Right.
And
Absolutely.
another important aspect of it is their philosophy. Their goal is completely different. So we learn all the same stuff, but it comes back to their philosophy, why you do what you do, right? That's what philosophy is. Like, who brushed their teeth this morning? Oh, everybody, right? There's a reason we all did that, okay? You're like, oh, it's good to take care of my teeth. You have some reasoning in your head why you do things like that. Same with why we do this. There's a reason we do it, and their reason is something different. They have a different goal. So we have different goals in mind. We want to restore function to the nervous system. That's our goal. Theirs might be something else. I don't know. I don't want to speak for them, but it could be increased range of motion in your shoulder. That's great. It's good. But we just have different goals too. So So,
Yeah, because it seems like that's really an important area for the whole body, no matter what. You know,
Yes.
if you just need an alignment, but it could be because the vagus nerve is out of balance.
Right.
And it's not going to get cured. So it's like,
Absolutely.
So when I was doing some research before I found you guys, and the term that came up wasn't a chiropractor, it was an orthogonalist. So I was like, oh, I've never heard of that, and oh, what do they do? You know, and it's completely different than a chiropractor, but yet you still call yourself a chiropractor. So, and a lot of people shy away from the chiropractor.
Yeah.
You know, the word chiropractor. So
Yes.
if you maybe you had orthogonalist or something, you'd be like, wow, this
Yeah.
is something new, some invent, you know what I'm saying? And this is what took me down the road, because I've been through every doctor.
Yep.
I followed everything around every doctor until I finally said, this is my last resort, and now I'm starting to feel relief.
Awesome.
You know, I mean, this took 4 years to get here,
That's awesome.
you know?
Well, what's really important to us, and the reason why we include the term chiropractic in our practice, is because this is what chiropractic is. This is what the profession was founded on. In fact, like we kind of showed BJ Palmer at the end here, he is the one that actually developed the technique that we do in our office, which is knee, chest, upper cervical. It's been highly advanced since that, but he's the one that he created the philosophy for what we do. Like you kind of said, this seems like a really important area that you should probably make sure is taken care of, right?
First thing, yeah.
He's the one that thought of that in the first place.
That was the first thing that should be.
And he's
yeah.
exactly so, and he's the one that created or developed, chiropractic in general. So now chiropractic is something that's known to the public and known to the culture as something completely different than what it really truly was founded on. And that's why it's important to us to include chiropractic in our titles as well, even though it's not what you may think it is.
Yeah.
Are there benefits with certain people going to doing this type of chiropractic and going to regular chiropractor for other adjustments?
I would say yes, but it's a case-by-case thing, you know? So obviously if it's something that the cause is not being addressed in one or the other, then yeah, it would be good together for sure. But if it's something that's, like for example, if someone has a really stiff knee and it just needs to be mobilized, that's all. It needs to be mobilized. That way it has better range of motion. That's the only thing they need. You know, there's aspects of that we could help with, absolutely, because obviously balancing your spine and balancing your pelvis is going to help with your range of motion in your knees, but ultimately it depends on what's causing the issue. So the answer to that is yes, there are benefits to both, but it depends case by case.
any other questions? We love it.
Yes, my daughter has migraine headaches, and my other daughter has headaches, but she was telling me the other day it's more in the front.
Mm-hmm.
Is that also considered a migraine, and what do you do for it? To get her here?
Yeah, so there's a bunch of different classifications for migraines, and there's different types. So just kind of based on that information, it could be classified as a migraine, but there's so many different types, and it kind of just depends on the symptoms. It's all diagnosis. So I mean, literally, it's all just a guess. Essentially, they just group these different similar conditions together and call it this. So, but yeah, at the end of the day, most people that have chronic migraines, you know, do you think that they're running to an upper cervical chiropractor first before anything else? No, right? They're trying to hydrate themselves. They're trying to take magnesium. They're trying to, you know, do all these things that are trying to take care of it, and it doesn't work. And that's why typically, you know, we'd advertise for things like, hey, we help with migraines, because oftentimes when you've had chronic migraines, you've tried everything. And then this is actually what's causing it, whether it's a blood flow issue from the top bone of the spine being misaligned or a nervous system issue. Hope that answered your question.
Thank you.
Any other questions?
One other thing that came to mind, when I had physical therapy years ago, they mentioned something about resetting the vagus nerve.
Mm-hmm.
How do you reset it? The only thing I remember is that I had to look in the corner, and then I don't know. I yawned and it just reset itself. So I'm just trying to remember from years ago.
So essentially, it's just a way of stimulating it. It's actually very similar to kind of what Dr. Case was talking about with the figure eights thing.
Okay.
So there's a lot of different methods that you can use, and it's kind of just person dependent too. Like there's some ways where you just look as far as you can to the left, look as far as you can to the right, and then essentially, like you said, there's different eye pattern ones. The term reset is a little bit misleading, if you will, but it's really just stimulating it to try to make your body induce a response. But, you know, if it's not inducing a response, it's not because your lack of looking in the corner of your eyes there, you know, it's because there's probably something else deeper that's causing it.
Cool. All right. Any other last minute questions before we have an exciting giveaway to still have be done here? Everybody's like, I just want to see the giveaway. I just want to see if I won. Come on.
Yeah. And then also, real quick, raise your hand if you got to get in the raffle. Eddie's got the thing, so get that
Any
taken
last
care of.
minute
for you.
All right.
Cool. All right, well, that kind of concludes everything. So, thanks everybody for everything as well. Appreciate it. And obviously, it's a Monday, so I'm sure there's a lot better things you guys could be doing after Monday to go 8 Mondays, right? And you're like, no, I love Mondays. I'm going to my chiropractor for a talk.
There should be like the wandering vagus nerve and the medulla oblongata. If you have any other things you want to hear us talk about at all, just write it on one of the slips and give it to us, or give it to Eddie or any Grace or anybody. We'd love to hear your input, what you want to hear next, or just tell us. So we'll keep a mental note.
Yep.
So awesome.
Thanks, guys. Thanks for
Thank
coming
you.
out. Yeah.